Introducing you to the people of Uniondale. This is the voice of Uniondale, Nicole Burke.
Hi, friends. If you're new to the show, welcome to the show. And friends who have been here before listening, thank you for that. Welcome back to the Voice of Uniondale. I'm your host, Nicole Burke, and thank you for tuning in to another powerful episode. Today, I'm excited to introduce someone whose story is all about purpose, bold transitions, and community impact. Meet Alisha James-Graham, a proud Uniondale native, Harvard graduate, a licensed life and health insurance agent who has spent over a decade helping people protect their most valuable assets, themselves. Alisha began her career at global financial institutions like Goldman Sachs and New York Life. But even with all the success, she felt called to something more meaningful. She made a bold decision to shift her path, leaving the corporate world to walk alongside individuals and families as they plan for their future. Now, she's on the front lines of Medicare planning and financial wellness, offering judgment-free guidance and a heart-centered approach to navigating complex systems. Her work is rooted in service, education, and empowerment, and she's showing up every day to make sure people have the tools and knowledge they need to live well. This episode is full of real talk, big insights, and so much heart. If you've ever asked yourself, is there more I'm meant to do? This one is definitely for you. Let's dive in and welcome Alisha James-Graham back to the show.
Hello, it's good to be back.
Right? Friends, we were talking off air. We were trying to figure out the last time she was here, and it was last April. Alicia said 15 months ago. So I'm so glad to have you back. Tell us what's new that's been going on. Is there anything new within the past 15 months?
Or 16 months. Yeah, right? Yeah, just continuing on the path. And we had some changes in the industry-wise. So that kind of has given me some more opportunity to kind of reach out to new people, different people, and kind of let them know what's going on. Because we don't often know what's going on until after it happens. And, that's normal, but we kind of, it's good to be prepared. But I've been continuing on that pathway of kind of just, educating, reaching out to people, and specifically in Medicare for 2025, some of the changes that have happened with Part D, which is your prescription drug plan. And that's based on the Inflation Reduction Act, which was passed during Biden's administration. So some of that I've been sharing, and, I guess we can go into detail if we want to, but some of that,
please do.
Basically, Part D is a pharmacy, basically your pharmacy medicines. And this year, there is no more donut hole. I don't know how many people out there have heard of the donut hole with their medicine.
What's donut hole? Is it delicious?
It's a nice munchkin.
Right?
I like to eat donut holes. However, this was not that kind of hole. Basically, it was a point in the year, depending on a person's prescription costs, where they would bear more of the burden of paying versus the earlier cycles. So, like they would have a percentage coinsurance on their prescription drugs. And that was from a certain amount spent was a threshold that they had to reach, that the plan paid and that they paid and the manufacturer paid. And then once they crossed that threshold, they had to pay more. And then there was another threshold where they got to. And then after that, it was catastrophic coverage. And that meant that they had to pay very, very, very little. The plan basically paid more. Well, this year, there's no more donut hole, which is nice for people.
Okay.
And there's also a cap of $2,000 out of pocket for Part D, pharmacy spending. So that's really great for people who have very expensive medicine. For everyone else, what happened is, of course, companies usually shift some of because it's more, the insurance companies now are paying more. They kind of shifted some of the burden onto the consumer in different ways. So some of the benefits that were there before have not been there. So basically, it's good for some people, and other people have had to kind of bear a little bit of the, oh man, we're not getting what we used to get.
Right.
But, that's how it goes. But a lot of people didn't know that. There's also a way for them to spread out their costs over the year, like a payment plan. It's called Medicare prescription payment plan. Very novel descriptor.
Are you signed because it's a lot of information and the government? Okay.
Yeah, it's a lot of information. So, but a lot of people, and things will come out in your, if you look at your mail, you might see it, but it's not again, how many people really like open their mail and look at it and read and understand it? So that's what as being a local agent, a local person, that's really what I'm trying to do.
So that's the changes throughout the year for
Part D, and that's across all, the whole industry. So it doesn't matter what company you use or what kind of plan you have, it doesn't matter. That's Medicare, CMS rule. So everybody.
Okay.
Yeah.
All right. So some people are paying more. Some people are getting more benefits.
Yes.
They take away and they give to certain groups. Okay.
Yeah. So it depends on where you fall in there in the spectrum. But basically, yeah. Either costs have gone up on some way, but yeah.
When you're doing these seminars, what are a lot of questions that you're receiving from the attendees?
A lot of them, like if I do, especially Medicare 101s, they often ask me about the different parts, right? So you have A, B, C, and D, and people are like, what is C? What is D? Do I have? So it really is a 101 on kind of explaining what each part means and what is C, because some people, they're like, oh, I should get C, or they see the commercials on TV and they're like, what do I have? They don't even know what they have. Some of them, if they've retired from a, public entity, basically.
Yes.
They have different situations. So a lot of the times they're asking about, what does this mean or their situation. Of course, they always ask like, what should I do or what's the best thing for me?
You got to get all your advisors in one room.
Yeah, exactly. Get everybody together. But it's really, and also, like I said, so, when I say something like what I just spoke about, what the changes are in the industry, then they really like, wow, I didn't know that. Or if I talk about Medicare savings programs, which are ways for people to get help paying, and you don't have to be on Medicaid. Like a lot of people think like, oh, I have to be on Medicaid to get help. And no, that's not true. And also sometimes people don't know the difference between Medicare and Medicaid.
Right.
That's the other thing. So it's really like all over, but it is really like a 101. And then people kind of want to know like, what do I, break it down to me.
Right.
So, which is great because that's what,
you're there as an advisor.
What I'm here. Yeah. Yep. To kind of say, well, let's talk about it.
Right.
Yeah.
So I'm just going to dial it back because you did mention a question on the cuff that I want to know. What's the difference between Medicare and Medicaid?
Medicare is a governmental health insurance system, right? Program for usually people over 65. You have to be a legal, either citizen or legal resident. Okay. And you have to be in the country for 5 years if you're,
a resident. Okay.
A resident. And you should, in order to get, so that's sort of the baseline. Also, you can be under 65 if you're disabled. You have certain disabilities. Oh. If you have end-stage renal disease, particularly, dialysis, things like that. So there's certain other conditions as well that qualify a person under 65 for Medicare. But that has nothing to do with income level. So anyone who's fits in those categories is technically eligible. Medicaid is for that's an income and asset-based healthcare system.
And it doesn't matter. You don't have to be above 65 or...
No. So that kids, you have babies on Medicaid. You have from babies all the way up to seniors. And that is joint funded by the state and federal government's Medicaid. So each state has its own Medicaid program. They may not call it Medicaid, but they have each state. But they get money from the federal government and they also fund it themselves. And that is... you have to have the lowest, your income has to be below the certain threshold that they tell you, and also your assets have to be below a certain threshold in order to get Medicaid. Right.
Understood.
Yeah.
and now going back to Section D.
Part D. Yep.
Part D.
Yep.
That's Medicare.
That's a Medicare, right? So Medicare has parts to it. And when you're getting your payroll, you get your check and you see the FICA come out, the payroll tax come out, the FICA that's paying for your you're paying into Social Security, and you're also paying into Part A of Medicare, which is the hospital and skilled nursing, kind of the inpatient, the hospital insurance, basically. Part A, that's what that is. And so if you worked 40 quarters, you get like your Part A, when you get Medicare, your Part A is premium free. So you don't have to pay for your Part A because you're technically paid into it already. And if you work less than that, there's little parts you got to pay. So yeah, there's all these little moving parts,
right?
But that's what it is. Yeah.
Well, I just want to say I understand a whole lot better now.
Oh, great.
Because of you and your explanation. So
thank you.
You did, it sounds like, and you did the right thing by switching careers.
Thank you. I appreciate that.
You made it easy to understand.
Yes.
What does one of your programs look like when you have them? Is it how long? What?
Oh, yeah.
How's it set up?
So normally, I don't know. I try not to go more than definitely less than like an hour or less.
Okay.
So again, like I'm doing like 101, like educational, when I do an educational thing.
Okay.
And usually if it's done, like I'll do it at churches, I'll do it, don't necessarily, or, someone was like, can you do it at, like
somebody's house?
I can do it at somebody's house.
Oh,
I could, yeah, seriously. I could do it in, a pizza shop, whatever. Like, I mean, it's as informal, it's formal, but it's informal.
Gotcha.
I mean, I'm standing up in front of, or I'm sitting at a table. Usually I have a presentation. So like I'll do a slide deck, but it's I try to be engaging and interactive, and, certain questions we'll answer during, other questions we'll wait. We usually have some kind, refreshments or whatever.
Yes.
So it's really just to try to break it down and, just be like homey, because honestly, just like Social Security, how I kind of went into this is like, these are things that you're entitled to if you worked it, you're going to use it, but you don't know if you don't know how to use it correctly.
Right.
Then, and there's so many, regulations and things, and they don't make it easy, especially with Medicare, because you're usually an older person. And, not to say that older people can't understand, but some of the work and the regulations and the language and the legalese and who's here and people are calling you and telling you anything.
Right.
And, taking advantage of certain things, and the trust, you have to be able to trust people that you're talking to about your own
trust is very
choices.
important, and I'm glad that you mentioned that. Alisha, is your role to sign them up or to guide them throughout the process? You don't just leave them alone after a year, do you?
No.
Like, if they have questions, like, what's your role?
So my role is to educate them first and foremost, and then where it's fitting and where it makes sense, yes, I will sign them up, and then I will be their agent. So like you see Jake from State Farm, like that's Alisha from wherever, right? from Uniondale. No, so it's the benefit of having a local agent, isn't it? And then after they sign up, like I service, I service you. So obviously I'm not the customer service at the insurance company, but I can help assist with certain things. I don't, some things you don't understand or whatever, like that's what I'm here for. Instead of calling 1-800 blah, blah, who, they can sign you up, but you try to get that same person back on the phone when you call back again.
Okay, so you're an agent.
So I am an agent.
And you protect your client.
Yes. Yeah. So when a person signs up with me, they're my client, and I'm responsible for helping them use their benefits properly, help understand it. If questions come up, things like that. So it's not just like, okay, now I told you, go have fun. Yeah.
Do you get calls in the middle of the night? Well, I have to go to the doctor, and what should I do? Do you get any craziness?
I haven't gotten like a middle of the night calls or anything. I do have some clients who I guess I would say more needy than others. Like they lean on me a lot because they either don't have family, or some of them are dual eligible, so they're Medicare and Medicaid, and sometimes on their services that they receive or they're trying to get, sometimes they need help with. In the meantime, we don't have any, or let's try to get you to somebody that can help you. So I have that, but thank God no one's called me in the middle of the night saying I'm at the ER or something.
Yeah. And I need to figure out what services I need to. Okay. Yeah. That's good. Anything crazy? Do you get any crazy stories, like one keep you on the phone for an hour? Because like you mentioned, sometimes it's a grandparent, it's an elderly person, and they want to tell you their whole life story.
Yeah, I have. Again, there's some that they don't have, they don't get a lot of visitors. They live alone. A lot of them are single people. And, sometimes they go out and they do their social events, social activities, at the senior centers or something. But they, they like to talk to somebody. So sometimes I'm the person that they talk to. And so, yes, I have had long conversations on the phone, and just being a listening ear, or just, telling them, they want to show me. I got a lot of this one woman in particular, she does jewelry and she does little paintings at the senior center. She always sends me them text message, sends me in a text like, here's what I did today, and so it's just nice.
Wait, let's even back up. They're texting you?
They are texting.
Okay. And sending photos?
There are photos. So some of my clients are very tech savvy.
Yes.
And some are totally not at all. And that's another thing. It's really, it's a variety. It kind of runs the gambit. And I like that. So some of them, you have to call them. Some of them don't have a cell phone or if they don't use it.
Right.
But I do get this one. And it's always, sometimes the ones, not always, but often it's the ones that you don't think are tech savvy. And they're like, oh yeah, no, I'm on Facebook. I'm on this. I do this. I do that. I'm like, oh, okay.
Go ahead, this lady.
Yeah.
So I want to ask you.
Sure.
For someone who is thinking of getting these services, what should they do first? When should they start looking into these services? What would be your advice?
So if anyone is getting close to 65, especially, and if they're still working, especially a lot of times now people are working after 65, right?
Yes.
So depending on your job, I always tell people, and sometimes the human resources will tell the person when you're getting on Medicare age, so you have to sign up for Medicare, even though you're still working and you're still under our company plan, but then there's, who pays first. There's certain things like who pays first once you get into Medicare. So I would say, number one, if you're still working and you're getting close to 65 and you're not retiring, either reach out to your HR department or watch out for any notices that you receive from them. If you've already, you're not working or whatever, you get anyone who's turning 65 has a 7-month window to enroll in Medicare. So
let me stop you there. Okay. 7 months from their birthday or 7 months from the calendar year? So when you're turning 65.
So 7 months. So it's based on your birth month. Okay. So if your birth month is July, you get 3 months before your birth month to start. So April, May, and June. So starting April, a person could enroll. And it's kind of recommended it's really recommended to do it as early as you can.
Okay.
So that way, July 1st will come and it's effective right away. You're ready to go. So April, May, June, you can sign up in July, then August, September, October. So it's 3 months before your birth month itself, and 3 months after. Okay. That's when you need to sign up for Part A and Part B. If you're working, you don't usually sign up for Part B. If you're working and you still have health coverage at your employer. Okay. Part B, because Part B is the one that you have to pay for every month that comes out of Social Security. So people, you don't want to double pay for things you don't have to. But if you don't sign up when you're supposed to, there's late enrollment penalties.
Oh my goodness.
And that's another thing. A lot of people didn't realize that. They didn't sign up for something. And then when they do sign up, they get hit with a penalty. And that doesn't go away unless you certain other things. You do if you're eligible for those Medicare savings programs I mentioned, they get rid of penalties. But if you don't have that, you're paying a penalty for Part B. You also can pay a penalty for Part D. Most people don't pay there is a Part A penalty, but most people have worked enough quarters in their life, so they don't even pay anything for Part A. So that's usually not a problem. But yeah, so there's late enrollment penalties if you don't sign up on time.
Okay, thank you for sharing that. I just heard you say, friends, open up your mail, and when you get that Medicare enrollment form, sign up right away.
Yeah, well, and even with Medicare, you have to go to ssa.gov. Well, I'm telling people if you can go online to sign up online versus trying to go in. And now with, budgetary cuts and things like that, I don't know how easy it is anymore to just, do it over the phone or whatever. So if you can go online, that's the best way to enroll for Medicare. Yeah, for Medicare. SSA.gov, the Social Security website.
Okay.
Yeah. But definitely watch for anything that comes from your HR department if you're working and you're getting close to that age.
65.
Yes, definitely.
Wow.
Because it's not necessarily junk mail.
How much would you say have you seen those late fees?
I've seen luckily a lot of people don't have them. I would probably say maybe 20% of people. That's kind of high, but it is about that. I've met someone who I did a Medicare 101. She had I want to say she had retired, or was eligible for Part B. I want to say 20 years. It was a really long time. She hadn't signed up, and it was 20 or 15 years or something. Ooh. And I was like, I guess you're not going to ever sign up for it. I'm like, what are you doing when you go to the doctor? Right. Are you just getting billed? I guess you're just getting bills. And she was like, I don't want to. I said, yeah, the penalty, you're going to pay a big penalty. So she was kind of like, I was like, unless you can get, the Medicare Savings Program. But I think she just was like, at this point, I don't care anymore. So I was like, wow. But I have met a few people.
20 years in?
No, not that much.
Okay.
But I have met people who didn't have it. She was the worst one, like longest.
Okay.
Then I've met some people who have had the penalty on they had it on and actually didn't know that it was a penalty, because with Part B, usually it's automatically taken out of your Social Security check.
Oh.
And they'll just, that will be added on, and they don't necessarily know there's a penalty.
Yeah.
That this is a penalty.
Oh,
yeah.
Sneaky.
So, yeah. So there's a few people like that who just, they're not aware.
Right. But is it an ongoing penalty?
Yes.
Or what?
It is ongoing. There's no stop. It is permanent.
So it's very important that you sign up.
Extremely important.
Okay.
You sign up on
I thought
time.
it was just a
No,
one time, like, a credit card, a late fee.
No.
Late penalty.
It's every month penalty until.
Wow. You don't need the services. Okay.
And
very, very important.
It's so it's super important. So I tell people, even if you don't, definitely, and like I said, sometimes your work will tell you have to sign up, but if they don't tell you, the Part B really will come into effect when you don't have employer group coverage anymore. Like when you leave your job, then you can get the Part B separate. You have a time limit on that as well, but Part B and Part D have time limits too after you separate from service, where you should get it before you get it. You will get an late enrollment penalty. So but I'm telling you, it's like it's 8 months here, it's 7 months here, it's 63 days. The Part D, if you leave your job and you don't have any other creditable coverage, which is drug coverage as good as Medicare's, when you leave, you have 63 days to get it without a gap, and then if you get it after that, you get a penalty. So. But it's like all different time frames, and so it's it's confusing, and you don't even know about it unless you go on Medicare.gov. You can go on Medicare.gov and get all this information. You can call 1-800-Medicare. You can get the Medicare New Handbook that comes. It's like 250 something pages probably.
Girl, who's reading that?
Nobody's reading it, and so right. This is the thing. This is the issue. So just like everything else. You gotta, somebody has to tell you. Sometimes you don't know what you don't know.
Right.
And then now you're like, okay.
I'm listening
it's kind of hard to be proactive when you don't really know everything that you don't know.
I'm listening to you talk, and I'm like, this should be given in a college course or something.
I know. Yeah.
Medicare.
I know you think, it's so long ahead. But just to know about, just to know.
Yes.
Yeah, you should be. Or for their parents sometimes. At that age, sometimes it's your parents who are doing it, and it's like, now I can help them a little bit.
Right. No, Mom, you should do this. Or, you know what they should just do? Just call Alisha James-Graham.
Call me up.
And with that being said, Miss, share your contact information with us.
Sure. So my phone number is 917-930-9246, and you can email me at alisha.james@gmail.com. That's the fastest way to get me. And I do have a 24/7 answering service, but if you call my cell phone number that I just gave you, and it'll tell you on there if you don't catch me and you want to really have them blast me, I'll give you a number. That'll give you a number on there. And I do have Facebook page as well, which is basically if you search Medicare Savvy, MEDICARE SAV as in Victor, V as in Victor Y. I do post as well, and of course you can reach out to me there too. I do. I could do
seminars. Do you have anything coming up?
So September 6th is the big Westbury Street Fair. I do a lot of table events. I do seminars. I do table events in Westbury. That's their street fair. I will have a table. I'm thinking I'm going to represent. I'm not sure which company I'm representing. I have an idea of which company I'll represent there.
Yes, you still have time.
Yes. So I will have a table, and I will have information on that company's plans. But of course, I will be open to talking about anything because I'm an independent. I'm not I'm contracted with companies, but I'm not married to them. I don't work only for one company. So that's the good thing. And I'm licensed in New York State. So, all of New York. If there's somebody who needs help, upstate somewhere, I have also a group of colleagues that I work with throughout the state.
Okay. And you can refer them.
Yeah.
Sounds good. Well, Alisha, you've been here before, and you know the way I like to wrap up the show by asking my guests to share something positive, something insightful that they've learned throughout their journey. Here's your opportunity to share that with us. Yes.
So I don't know, I probably said this last time too, that my favorite quote from Henry David Thoreau is like, go confidently in the direction of your dreams, live the life you've imagined. And I guess, I'm kind of trying to do that. But I also thought of on the way here, I was like, you know what? Find your people. Find your people. Who are your people that are really like going to support you? And that over your life, you get so many people that come into your life, and you kind of make them, you have the ones who kind of become your tribe. And I think wherever situation you find yourself in, if you can find your people, it's hard to do that sometimes, but finding your people to kind of help you go along. I've been very blessed and fortunate to have people who are, come into my life, and, I think we've helped, help each other out and just give back out to the universe all that you've received. And I just love that. And I love thank you for your feedback, Nicole, because what you just said about, me making things clear, it just helps me, continue along this. So I'm very grateful.
Oh, you're so welcome,
Thank you.
Alisha. Thank you for sharing that with us. Friends, you've heard it here from Alisha James-Graham. She is on the front lines of Medicare planning and financial wellness. She is an independent contractor. She gave us the quote from Henry David Thoreau. I didn't get all of it, but basically it says, go confidently in the life of your dreams. Whatever you wish for, just know within confidence you have whatever it is inside you to get that dream going. And she also says, find your tribe in life. In life, we go through some struggles at times, some situations that might hold us down. Know that there are people out there. Find the people out there who will support you in anything that you go through, your ups, your downs, and be that person yourself for someone else.
Definitely. Thank you.
Oh, you're so welcome. Thank you, Alisha.
Good to see you again.
Yes, and let's not make it another year.
No,
another
we won't.
15 months.
We won't.
Say hi to Mom for me.
I shall.
Thank you for being here.
And thank you for having this show and this outlet for everyone, and can wish you all continued success with it.
Oh,
all the best.
Thank you, Alisha.
Yes,
thank you.
Seriously.
Oh, I appreciate that. You got me a little bit speechless. That's okay. We're having fun.
We are.
Thank you, friends, for listening. Friends, you are listening to The Voice of Uniondale. My name is Nicole Burke. Make sure to follow us on Spotify at The Voice of Uniondale to hear great stories from Uniondale. And make sure to return next week to hear another journey from Uniondale. Bye for now.